Hello, welcome to this video podcast. My name is Kris Kowdley. I'm director at Liver Institute Northwest and professor at Elson S. Floyd College of Medicine, Washington State University in Seattle, Washington. And I'm delighted to be joined today by Sabrina Reeser, who is a patient living with PBC. Sabrina, thank you for joining us.
You're welcome. Thanks for having me.
So I wanted to get your perspective on treatment of PBC and what your view is as a patient living with PBC with regard to treatment options. We'll talk a little bit about what you perceive of as the current standard of care and how these treatments are tolerated and what unmet needs there are from your perspective. So describe your journey in terms of treatment with PBC, like uh, since you were diagnosed, what were you initially started on? And how did that work for you? Were there any second line treatments? And just your experience from a patient's perspective of what works and what doesn't work in treatment of PBC.
So I was diagnosed with liver disease in 2016. It was 2017 that they started looking at PBC and started me on urso. I was on that for, oh gosh, 3 or 4 years before I started seeing my specialist. And it was determined that I was a non-responder and not tolerant to the urso. And the next options that were best for me was looking at clinical trials for treatment.
So what was your experience with urso as a treatment? And did you find it to be easy to tolerate? Was the dosing and frequency of dosing an issue? Did you have any side effects from urso? What's your perspective on your experience with urso?
With the urso, I had a lot of gastrointestinal issues with it that never seemed to resolve. It just hung out and wanted to be my friend and didn't go away. Um, Other than that, I think I tolerated it fairly well. Um, so, but it wasn't doing what we needed it to do. So my numbers weren't going down or any of that.
Yeah. So we know that urso, clearly has been an established therapy now for decades. And for many patients, it works very well. But I think a lot of patients experience GI symptoms, and these can be quite vague. They can be anything from a vague sense of stomach upset, queasy stomach. Some patients report that they have loose stools, gastrointestinal distress, and it's not trivial. And in my experience, sometimes it's a little bit worse in patients who have had their gallbladder out, but it sounds like you had pretty much all of those symptoms. So it sounds like you were in that category of about 10% to maybe 20% of patients who are intolerant of urso. And then did you ever experience second line treatment with either obeticholic acid or a fibrate like fenofibrate?
No, I have not been on either of those.
And I think one issue for you has been that you always were bothered by itching, is it not? And that was one reason that obeticholic acid was not considered to be a great option for you because you already had quite a lot of itching. Is that true?
That is very true. And you guys will probably notice that in the video. I I itch a lot.
Yeah, let's spend a few minutes talking about that. How much of a limitation on your life was and is pruritus or itching?
Um, Now it's become significantly increased. I I am finding that as my itch is getting worse, it's all day long, all night long. Um, I'm very aware of who I'm around, where I go, because of the itch and what's perceived when you're itching like that. I've started at church, I try to sit in the back so that people aren't behind me thinking, why is she itching all the time? What's going on? Um, at work, thankfully, all my coworkers know and they're all very supportive. And they will ask me, hey, can we do anything? Can we get you ice packs? What can we do to help? And my family's that way too.
Yeah, no, that's great. So it sounds like you've got a relatively supportive environment, but clearly, from your perspective, it sounds like, and I'd like to use your words to describe it. We, I think, as healthcare providers or healthcare practitioners, we are very focused on slowing down the progression of the disease, trying to look at laboratory testing. We often probably will tell you about the importance of alkaline phosphatase, bilirubin levels, maybe gamma GT. And from your perspective as a patient, what do you see as, is there a disconnect between what the doctor is talking about and what the patient feels like is their need? Or do you feel like, they're pretty well aligned?
It depends on the doctor. I have had some doctors where there's a huge disconnect. Um, and what I feel, what I'm experienced has been very much dismissed. But I have got my primary and my PBC specialist are amazing with listening. They, it's almost, although the blood work, slowing the progression is very important, and that is discussed and covered, but so is quality of life and what's important and how the itching, fatigue, any of those things that go along with it affects us and what can or cannot be done to help it.
Yeah, I think this is a really important point, right? Because there are the patient's symptoms, which are very frequently, if not dismissed, I would say certainly overlooked, and partly because these are longer conversations, and we frequently, as physicians, have not had any effective therapies. And some of our therapies are actually making the symptoms worse. For example, with pruritus. So it's definitely very frustrating from a patient perspective. From the standpoint of talking about the blood work and the stage of the disease, how well do you think we as doctors, do in terms of explaining the importance of the blood tests, the FibroScan, the biopsy, etc.? Do you feel like that is something that is explained in a way that's meaningful? And then I'll talk again about in a few minutes about the symptoms. But what is your take on kind of how we communicate to patients the reasons we're focused on the blood tests and the stage of the disease?
Most of my experience has been very good with that. The information I'm given, the why it matters, what it matters for, is always very well given to me. It's put in a way that I can understand. Um, it's gone over thoroughly, and there's always, do you understand this part of it? Making sure I understand before we go to the next step of discussion, because a lot of those medical terms can be very confusing. And my experience within the last couple years is that's been a very well thought out process and explained in a very thorough presentation, and making sure it's understood not just by me but also my husband.
No, that's great. That's good to hear. I know you're active with other patient groups, and you've been forthcoming about talking about your journey with PBC, and thank you for that. What's been your perception about what other patients have communicated to you? Do you feel like that is something that we're doing a pretty good job of as a rule, or is it more the exception that patients feel like they are pretty well, they have a pretty good grasp on why these tests are important and why we're trying to improve them?
I feel like it's the exception. A lot of them do not have that.
No, I think that's helpful, and I think this speaks to the importance of this project that we're engaged in right now, as well as the need for future education is those of us that are taking care of a lot of patients with PBC, involved in research and teaching. I think we're much more tuned into this, whereas the importance of explaining laboratory tests and why they're important is probably not as easily taken up by a lot of treaters. From your perspective, what are your priorities in living with PBC?
Um, Slowing the progression down, that's important for me. I want to be able to live my life and not have to be miserable all the time. I don't, I have plans, I have dreams. We have 20 acres of land that we're working on and going to be building a home. And I want to be able to be a part of that. I want to physically be able to do it. So being able to slow down my progression while still having a good quality of life is important to me. I don't want to get a transplant if that's at all possible. I want to, and this may sound weird, but I want to have my own organs in me as long as I can. Um, my goal has been not until well after I'm 50. So if that's what's meant to be or not, I don't know, but that's my goal. So and I think being able to obtain that goal, I've got to have the progression slowed down in order to. So that to me is very important, but so is symptom burden management.
Yeah, no, that's a great summary, and I think that there's nothing wrong with wanting to keep all your organs inside you for as long as possible. And I think that for some people that is not something that they're able to achieve, and for we're hoping to do that for more patients with PBC all the time. Now, you have a unique perspective in that you have been a participant in clinical trials, and love to hear your experience of what that's like, and whether you would recommend that for other patients. And then where do you, and kind of along that same line, based on the clinical trials, where do you think the future holds for PBC?
So I would 100% encourage anybody to be a part of a clinical trial. They're important. It's by others being willing to be a part of a clinical trial, that's the only way we're going to be able to advance and find treatment options for not just PBC, anything that might be out there. Whether it's for the slowing down the progression, helping with the disease, the fatigue, any of those kind of things. If people are not willing to participate in that, then you guys as doctors can't really find anything to help us. My experience with clinical trials is it's a huge time commitment. I mean, there are things you have to be willing to commit to. For us, we travel 7 hours to be able to be a part of it. And then once we're done, it's traveling home. So it's a couple day process for us going over, doing the appointment, and coming back. But it's worth it because even though I may not always be successful on a clinical trial, other people are. And I might have to change paths along the way, but it gives hope. And there's so many advances coming out. I was just at a conference a few weeks ago and listening to everything that doctors and researchers are working on for PBC. It's amazing. It's encouraging. It's hopeful.
No, that's very inspirational, and thank you for being willing to share and also to participate, because you're absolutely right. For a rare disease like PBC, we're never going to make progress and find new therapies if patients are not willing to generously donate their time. And I always like to say that the patient didn't fail the trial failed the patient. So you should not feel like you did not succeed. The medication did not succeed. So, in closing, kind of, do you have a wish for, what the future might hold for new treatments in PBC, and what would you like to see happen for the future generations that may be dealing with PBC, in terms of how would you like to see the treatment landscape change and the treatment options improve for patients?
Well, having more treatment options to start with would be amazing because we're kind of limited. Um, so being able to have more options out there, different things to try without having to go through a clinical trial, that of course is always a huge thing. Um, Finding a cure would be amazing. That would ultimately be for us with PBC. Um, I don't know why I'm getting teary eyed, but yeah, a cure would be our top thing. But until that happens, something to slow it down so that we can fulfill our dreams, we can do what we planned with life.
No, that's
Sorry.
great. No, I think thank you for sharing your perspectives, and being so honest with your feelings. I think that that's our ultimate goal, is to find a cure. But until we do that, I think our goal is to have therapies that not only slow down the progression of the disease, but also at the same time improve symptoms and quality of life. And ultimately, absolutely, everyone that is invested and passionate about treating PBC would like to find a cure. And we've found cures for many other diseases, and so there's no reason why we shouldn't aspire to do the same for PBC. So thank you so much. I appreciate it. And thank you for spending a few minutes with us.
Well, thank you for letting me be a part of this.